Let me just say a couple things about some of the issues that we've been working on that I think are particularly important to folks across the New England region. In fact, the other 5 New England governors were here with me day before yesterday over at Harvard Medical School for a conference that they were holding on opioid therapies. And, you know, the good news on this one is I do believe it's generating far more attention and far more awareness, certainly than there was about it 2 or 3 years ago. And I think that's positive, but the big challenge we're all going to face on this one is how to take something with so much momentum and try and move it in a different direction. And the big issue with momentum, particularly when it comes to something like the opioid issue, is the whole issue of sort of standard operating procedure, standard practice, almost like habit with respect to the way people deal with these kinds of medications. We represent in the United States 5% of the world's population. We represent 80% of the world's opioid prescriptions. And while you can see a little bit of a turn on the prescribing issue over the course of the past year or two, you're coming off such an unbelievably high number to begin with that it's going to take a while to get to the point where I believe we can actually start to bend the trend on some of the addiction issues that are associated with this. And this is, you know, Governor Shumlin talked about this. This was the primary issue in his State of the State address in the state of Vermont 3 years ago. It was one of the 3 big issues I talked about in my inaugural address. It is something that Governor Malloy, Governor LePage, Governor Raimondo, Governor Hassan have all sort of had to face directly in their own states, and that's because it's simply not something you can avoid. If you put 20 people in a room, and there's obviously a lot more than 20 people in this room, I guarantee you will find somebody among those 20 for whom there is a direct connect to this epidemic and to this crisis. And we're all chasing it in a variety of ways, but they all break down into sort of 4 or 5 categories. And the first one is prevention and education, and that has to do with things like limits on first-time prescriptions. In Massachusetts, part of our law included a 7-day limit on first-time prescriptions. That also has been adopted in Maine, and it's going to become an element of a proposal that Governor Hassan and I, as the co-chairs of the Health and Human Service Committee at the National Governors Association, will be making to the National Governors Association to be adopted by the NGA at its meeting this summer in Iowa, incorporating into the health and safety seminar that takes place at the beginning of every sports season, no matter what sport you're playing in middle school and high school. We talked historically with kids and parents and coaches about concussions. We've talked to them about dehydration. We're incorporating the issues around managing pain meds and dealing with opioids as part of that conversation as well. We're also developing curriculum around this for middle schoolers and for high school kids. And we also cut the first-in-the-nation deal here in Massachusetts, and this is something else the rest of the New England governors are going to be pursuing, which is to bake into the core curriculum in all of our medical schools, nursing schools, and dental schools a requirement that you can't graduate until you've passed a course in opioid therapy, pain management, and addiction. Because, frankly, one of the more interesting and troubling elements of all this, and I figured this out as part of our look into this, unless you are in a very particular field, maybe orthopedics and maybe pain management, historically it's pretty likely you graduated from nursing school, medical school, or dental school without ever taking a course in opioid therapy or pain management, which is a big problem. And so this is getting now baked into the curriculum here in Massachusetts. Everybody's going to have to take it. The Mass Medical Society has been terrific. The Dental Society's been great on this. The nursing community's been great. And we've also incorporated in this statute we passed in Massachusetts, and this will be part of the national model that we present to the NGA as well. That there ought to be an in-service education requirement on a going-forward basis for anybody who's a prescriber. Because frankly, when you talk to a lot of the folks who are on the prescribing end of this, they'll be the first to admit that they do not feel like they have as much information they should have about what best practice and the right practice is. And this, you know, before I came in here this morning, I was reading an article on my phone that was in STAT, which is the Boston Globe's healthcare section. That is a story that was written by somebody who had a terrible problem with heroin once upon a time. They got clean, and they had a series of medical procedures. And the story is about the fact, the headline of the story is, which is why I read it, was something like, why would somebody like me, who's a former addict, be prescribed so many opioids in the course of my experience with the healthcare system? And it's a really compelling tale about the fact that despite all the public attention that's been paid to this, despite the fact that we're baking this into in-service training, despite the fact that we have sort of a whole new sense of awareness about this within the healthcare community, he believes his course, which was here in Massachusetts, among the very best hospitals in the country, that his course of treatment wildly overplayed the opioid piece, despite the fact that over and over and over again, he and his wife said to everybody who he was dealing with, you know, I'm a former addict. And I think the whole issue about habit, I don't know how else to put it, the whole issue about getting people to think really differently and to disrupt the way they thought about dealing with this on the front end has got to be a big piece of the answer. Because this didn't happen by accident. If you look at all the data that tracks prescriptions, overdoses, and deaths, those three numbers run with one another almost in complete parallel parallel lines for the course of the past 10 or 15 years. And we will never solve this problem if we don't deal with that particular issue on the front end. So there's a ton of work going on there to educate coaches and parents and kids, but there's also a ton of work that's going on to educate prescribers. And I really believe that the prescriber piece in particular is something that's got to be a major part of this, or we're never going to find our way out of this. The second big piece that we talked about with the governors was trafficking, and the fact that this is an area where we can work together and are working together across state lines to deal with the opportunities we have to take some of the people who are on the dealer side of this out of the equation. The third piece is prescription monitoring. By the fall, we'll probably have an interoperable prescription monitoring program that all the New England states will be able to work off of together, and practitioners across the New England states will be able to work off together, and they will have for the first time access to data that will make it possible for people to have a pretty good sense about what's going on with respect to doc shopping and some of the other issues that are related to that across the region. And again, this is something where all of the governors are in with both feet. Their legislatures, for the most part, are also in. But it's going to take a huge lift on the part of everybody else, and especially the medical community, if we're going to get to where we need to go to deal with this terrible crisis. And the final point I'll make about this, there were 1,500 people in Massachusetts so far that we're aware of who died of an opioid overdose in 2015. 1,500. And by the way, it's probably, although the numbers are getting a little closer primarily because of the arrival of fentanyl, for a long time it was sort of 2-to-1 pain medication to heroin. Everybody thinks when I talk about deaths, I'm talking about heroin. Pain meds has always had about a 2-to-1, 60-40, 65-35 share of the number of deaths in this. It's only been in the last year or so with the arrival and the visibility around fentanyl, which is a really deadly opioid that's currently showing up in a lot of the heroin. That heroin has started to move on that opioid number. So when people talk about opioids, most of us are talking about pain meds first, heroin second. And typically most of the studies will show you that about 4 of every 5 people who end up addicted to heroin started on pain meds. So this whole pain med piece has to be a big part of the answer in this if we're going to get anywhere. 1,500 deaths in Massachusetts, thousands and thousands of administrations of Narcan, which is a death-defying antidote for somebody who has overdosed. And nobody knows exactly how many deaths were prevented, but if you look at how many times Narcan was administered in Massachusetts, you could easily presume that without the availability of Narcan, we would have lost somewhere between 5,000 and 6,000 people last year in Massachusetts, not just 1,500. And that should give you some idea about just how broad and how widespread this particular crisis is that we're talking about, not just here in Massachusetts, across the country, but definitely across New England. And the governors are working pretty hard on this together.